Hundreds of thousands of Americans suffer from irregular heartbeat, and one of the most treated heart rhythm disorders is called atrial fibrillation, or AFib. Now, a new treatment option is available at Trinity Heart Center in Rock Island and is among the first in the nation to use this new technology. And joining us now to talk about it is Dr. Mark Shen, an electrophysiologist and cardiologist. Dr. Shen, thank you so much for joining us. Let's start with what AFib is and what some of the symptoms are.
Hi, thank you, John, for having me here. So my name is Dr. Shen. I'm one of the electrophysiologists. I call myself electrician of the heart. So AFib is the most common electrical problems of the heart. It's a heart rhythm disorders. It is, irregular rhythm of the top chamber. We call it atria. Some of these patients can feel it. Some of them don't feel it directly. But if you let AFib continues, it will get worse. It brings some other more important and devastating complications, such as congestive heart failure or stroke. I think that is the reason why we need to be aware and get treatment early on.
And importantly, how many people are affected by something like this?
So the incidence of AFib goes up with age. So, with the population ages, the incidence of AFib goes up. So the rough estimate for people over 65 years old, about 1 in 8 people, they have AFib, whether they know it or not. We've seen people who are younger, they suffer from AFib, probably due to the lifestyle, the obesity, the prevalence of sleep apnea, etc. So I think this is an under-recognized problem in the general population.
All right, so now let's talk about some of the new technology that's out there to treat it. Can you tell us about what that is and how it works?
My pleasure. So we've been doing something we call it AFib ablation for some of these, we call it, AFib patients who can really feel their AFib is affecting their lifestyle. Ablation is actually not a good word. What I like to say is we try to fix the patient's heart rhythm by removing these bad cells that generate AFib. Historically, we've been using thermal energy, which means we either heat up or cool down the tissues by killing those bad cells that generate AFib. The new exciting technology that we brought in, actually, as just last week at Unity Point, Rock Island, is a totally new method of removing these bad cells. Instead of heating up or cooling down the cells, we use a very short, high intensity of electrical impulses that very magically opens these cell membrane pores and lead to cell death. And remember, we're trying to kill the bad cells. With this technology, we're able to preserve the good cells or the neighboring structures, the vitality of those structures. So in the past, we always worry about this thermal ablative technology can damage these nearby organs when we do the AFib ablation. With this new technology, it is proven to be safe and, more important of all, is efficient. So it's a safe, efficient, FDA-approved technology, and we're very excited to bring this technology to the community. And my personal experience among my other colleagues, we started to do this, and this is amazing results. I can, do these ablations without worrying damaging other organs, which I always worried in the past.
Dr. Shen, yeah, I would agree. It's very neat that we have this here. You don't have to travel very far for it. Dr. Mark Shen, thank you so much for taking the time this week to educate us on this.
Thank you very much. My pleasure. Thank you for having me. Thank you.